it's your girl KV
and Celine,
and we are back with another episode of the Hood Health Report. Today we have a guest. You want to introduce yourself? Just tell them a little bit about yourself, and then we'll kind of intro the topic.
Definitely. First of all, thank you for having me. I really appreciate it. My name is Dr. Andrea Jacobo. I have a doctorate in public health, a master's in public health, a background in exercise science. I'm a type of person that call myself like a health organizer in terms of being able to bring community into the spaces of health and well-being. My research really focuses on participatory action research, which means that people are centered in the research process, especially when we talk about health and well-being, so that we can make sure that culture is centered, that the lived experiences is taken into account, and basically all things health and well-being and healing for the people. Yeah, that's what I would say in a nutshell.
That is great, and that is the exact reason that we have you here today, because we know with, the state of this place,
that's right.
There's a lot of changes that have been going on, in particular with healthcare policy and just healthcare initiatives all around. So we definitely wanted to dive into that conversation. We were going back and forth like, who can we ask? Who can we figure out? Because I was like, this is a conversation where we're not as well versed. So I was like, I definitely want to bring someone in that could be able to really explain that stuff to us, not just the guests. We learn here too. Yep. So I definitely am glad that you are here with us today.
Yes, definitely. Thank you so much.
So we already kind of got a little bit of an intro. Is there anything else that you want to add about like your background, how you possibly got into what you're doing, working with communities, making sure that well-being is exposed to everybody?
Right. I do want to clarify that, while I say public health, it also includes healthcare. And so I did start as working in clinics to bridge clinical practices in community. And so while I am more on the community side, there is a lot of intersection between healthcare and public health. So definitely have a lot of background in that, especially making sure that clinical practices are within the community and vice versa.
Yeah, I think because we are in public health, we already know that, but maybe our audience probably really didn't know this. I'm glad you cleared that up for them.
Right, exactly. And I think it's important to say, because typically to talk about healthcare and then public health, but it's together.
Yeah,
it really
is intertwined.
It really is,
yeah.
So what made you decide to continue your journey in public health? I know Celine and I, we both go back and forth with, do we want to get a doctorate? Should we get a doctorate? And so we always kind of go back and forth about that. So anytime somebody has a doctorate, especially in our field, I always ask, what was that push to make you go for that doctorate?
I think one reason that I wanted to do a doctorate in public health versus a PhD was to expand on my leadership skills within the field of public health. We are trained similar to PhDs. We go through a very rigorous academic process. However, one thing that's really distinct about the DRPH specifically is that we have to do a practicum. And it's actually not just the 200 hours or 280 hours in master's. We actually do a full year or a full summer. And so we have a higher requirement. And I think that allows us to deepen our theoretical, our research practices, and embed them in with community. And I was just tired of doing work for others and not getting the credit. And unfortunately, having a doctorate allows you to say, this is what I want to study, versus I got to study this because my PI or the person that's in charge is saying, this is how we're going to do this. So I wanted to call the shots.
I like that. It makes me feel a little bit better about it because, like she said, we have our masters, but we haven't went a step further. And it's always one of those things where it's like, when you bring up, oh, this is something I want to do because I want to call the shots, it relates. It hits home. It really hits home.
And honestly, I want to encourage y'all to do it. There is less than 1%, less than 1% of Black women have doctorates, and it's done by design. It's a very hard process, but once you go through it, it's important for you to be there. And so
in that
make
space,
this design. Go ahead and get your doctorate. Now, when you do it, make sure you're really doing it for the right reasons.
Right.
Because it's a process that it will put you through it. And I'm only saying this not to deter you, but to encourage you to center yourself in the process. Yeah.
Woo, okay. That was heavy, but I needed that little morning that little message this morning. So, like we mentioned, or KB mentioned when she first started, this episode is going to be more so focused on healthcare policies and some of the policies that are going on. Let's get into it. You know, Trump is back in office, and we've stated our concerns on our platform before, but do you have any concerns about him being back in office for people that, you know, are in healthcare or in public health spaces? You can just go ahead and like lay some of those out for us.
I think we are all feeling that. We are all feeling the stress of having someone in charge that doesn't consider the importance of science, the importance of health, the importance of actually having practices that help the health and well-being of people. And so my concern is just, it's a trickle effect. It's a systemic issue. If at the top, they say this certain policy cannot, let's say, removing the Affordable Health Care Act. Right? What does that mean for insurance? What does that mean for medicine?
Yeah.
What does that mean for how people gain access to care? And also just like extending beyond health, because health is political. Health is a determinant of different social drivers like immigration, even having the ability to be healthy and well enough to live in affordable housing and having just all these different elements that are. While we're talking about health, there are so many implications to that. Because the Affordable Care Act is not just about hospitals.
No. Right.
It's about how we are able to provide care for the people beyond the hospital, as well as keeping hospitals accountable for the care of the people, right?
Yeah.
So I'm just really concerned with the rhetoric.
Yeah.
I'm concerned with how people are going to put value into certain aspects of public health, of the need. Eggs are $9.
That was the last topic. Food inflation.
That food inflation is real. And of course, there's a lot of other economic challenges in that has led us to there. But still, there's just so much that they're signaling that we're going to have a wild 4 years.
Wild. And then you got to think about when it comes to Affordable Care Act as well, prescription medicines. They're removing the caps of how much something can cost. So now insulin, thousands of dollars. People can't afford it. People don't have the health insurance that offset that cost anymore. So it's very much just a crazy trickle-down effect. And then education. Trying to take money away from education. And it's just like...
Yeah. Recently when he, had that executive order for all universities to eliminate any race-based programs from their colleges and universities, that's hard to hear because I'm a product of that.
Same.
Right? Academic institutions are not meant for people of color.
No, not at all.
And we know that because that's why we have HBCUs. That's why we have colleges that are focused on Hispanic serving institutions. Understanding that we have unique needs to address kind of like this upward mobility with education. When we remove those things from PWIs,
where does it leave us?
Where does it leave us? So my former university, before my master's, there was a little bit more diversity when I was there. I went back a couple months ago and I looked around campus. I was like, man, what happened to all the people? And I think those are the implications that we're starting to see.
Yeah.
Right?
Absolutely. We did an episode on that last season, how the DEI rollbacks are affecting schools, jobs, grants, just everything. Is the scope of everything is just about to change with that.
Right. And I do want us to think about, like, while they are pulling that back, people are becoming more innovative in the way we are trying to engage with one another.
You have to.
We're pivoting.
Yeah, you have to adapt.
This is another 2020, another COVID.
Yep.
We are in this infodemic. We are in this issue of that the media is dictating how and what is important.
Right.
And so, yeah.
So, speaking of all the healthcare policies and things like that, I think it's important to mention something that I saw on social media the other day. They mentioned how we don't see coverage on the United Healthcare CEO shooter. We don't see the coverage on that anymore. Like it's just dropped off the face of the earth. Somebody was like, oh, so once they realized that we see him as a champion and a hero, they stopped giving us all of the news on that. And so that was interesting to me, for one. And what are your thoughts on that from a policy standpoint? Do you think that all of the fanfare around that now and how healthcare policies are structured, do you think that this could have any effect on that in a good or bad way?
So everything's by design, right? There's actually a policy analysis called the window of opportunity, and one of them is the media coverage, right? Like if the people or the attention, it's like the attention of the people are to a certain policy, this policy can be pushed forward, right? Or be removed because of the attention. That's what happened with the Affordable Care Act. It was like a three-pronged thing. We got a black man in the office. We knew that we needed to have issues. We had issues of healthcare, and it had so much attention and was able to pass, right? So the same thing that's happening with like the health with Luigi, right? He's bae. Right? Because he is doing what he did was showcase the frustration of the people in terms of being denied insurance, of being delayed care that has caused even more issues in the future. And so there's this negative feedback that we're experiencing with large insurance corporation like United Healthcare. The more attention that we had on Luigi, the more people were able to advocate for themselves. No, we're here. We're about to change this. And so that's a problem. Yep. So the media is not covering it as much because they knew the more that they would cover Luigi, actually it did the opposite. It just amplified, and it's something that it's an anomaly because from the people all the way to the people who are working, the people on grassroots and the people at grass tops, they were like, yeah, what he did was wrong, right? Yeah. But at the same time, we could see the good of what he was trying to do. Especially how detailed.
The message.
Right.
The message, right? It's kind of like the bullet that was heard around the world, right? And so media controls the masses. We heard that with Beyonce. Period. The media controls the masses. And so the visuals, in this case, Luigi being the person, and especially Luigi being a person that is not a person of color. Right?
Exactly.
That's what makes it even crazier, right? And so with the media not covering him, it's intentional. It's an intentional way for us to not know what's going on with this this case, but also forget that we have a policy in hand that we could change, right? So the media knows what it's doing.
Do you think this could affect how they structure policy in any way?
Now, I feel like we could have distractions from what people are, how it's structured. We started to see there's more security over the CEOs of companies that were
They were taking it off the website. They took their names and bios and stuff off the websites.
Right. So that's like, you could talk about how that's a policy that's been in place. But necessarily within like the healthcare, especially with how insurances are being, what they approve and what they don't approve. I think it's too early to tell where we are, because there's so much going on.
Yeah. Chaos.
It's so much chaos. We can't even think about that when he has an executive order per hour. So essentially what I would like y'all to like think about is we have to be proactive when it comes to media. We have to be, because we know that if we're passive, we're going to lose information that's critical. And unfortunately, with the way that, Trump has an executive order per hour, the breaking news at every 30 seconds, we lose the thought of what's happening with insurance? What's happening with this case? Because that was up on the top of the news when it first started. But now we don't hear it that much. I do want to say this. I don't know if y'all saw the interaction between people who were incarcerated and the media. I don't know if you saw that clip. There was a clip. There was someone outside where Luigi was being held, and it was live. And they were watching, the people who were incarcerated were watching the show as they were in front of there, and they were interacting with the actual anchor. And that's to the effect of how much media and how much coverage around this was getting from the inside through the carceral system, also with people from the outside. And so it's just like one of those things. That's why the media, I feel like, okay, we got to bring this down and focus on other things. Because if we do that, the people who are most vulnerable in our population that's supporting something that occurred that was an anomaly, in what ways can we build different ways to communicate with each other and try to change the system? Right? And so the media knows.
Yeah. We have an episode coming up about media, so it's interesting to hear you bring in the media topic. A lot of our topics kind of like correlate with one another. We started talking a little bit about the Affordable Care Act, and I was reading an article about it, and I want to just like mention a couple of things before we move on to like our next portion or subject matter. This article was basically written a little bit before Trump was in office, but it was more so saying like what their thoughts would be if he was to get into office, and like maybe what would happen. A lot of this stuff has already started to happen, so because we knew that this was going to happen, but it's just interesting to see like some of the things that they were predicting and how some of those things are starting to play itself out. It had a lot to do with the Affordable Care Act, Medicare, the reproductive care, and then also abortion. We haven't really talked about that a lot yet, but those are all topics that he's mentioned, and we kind of felt that were going to be big topics once he was in office. A lot of people were worried about like the erosion of the Affordable Care Act, how it would affect insurers. Right now uninsured rate was at like 8% if the numbers are going to increase or if they're going to decrease, which of course they're probably going to increase because people already couldn't afford health care, and the way the system is set up, it's not for everybody. We know that. And then also some of the cuts that he might make to Medicare, and the health analysts expect that the program will have vulnerable cuts, spending cuts for that reason. As far as the reproductive rights, Trump has he said that he was going to, let the states have their decision, and we'll see how that goes. We know that 13 states have an abortion ban, and then 28 have restricted rights. He's also said that he wouldn't stop the sale of abortion pills through mail, but you never know with him. We're not really sure what he'll do. What we are kind of concerned about, or what some people have said their concerns would be, are the FDA doing their own kind of ban. So like I'm not sure if you know about the Common Stock Act, which basically makes it illegal for you to ship those pills throughout the United States. Those are like some of the concerns that I felt like were important for us being in healthcare and then dealing with like public health, those are like things that we see on a daily basis. People needing those access to like insurance, people needing access to like reproductive things, whether it be because you need an abortion or whether it's because you have like infertility, all those types of things. So you mentioned in the Affordable Care Act and how there might be some chances that it will be affected. It was good to like hear from your perspective and then also tie back into the article.
Yeah, I think I appreciate you bringing that to the center of the conversation. There's a lot of factors, right? There's a lot of factors, a lot of people who are part of this Affordable Care Act. It's not just, it has to be passed by both the House and the Senate. It has to be approved by both parties. It has to be bipartisan in order for it actually to pass. The Affordable Care Act is a bipartisan bill. And so while we do have this stress of Trump sharing these executive orders, we do need to call on our constituents, our like the people who are representing us in DC, right? Do you know your House of Representatives? Do you know your senators? Do you know who's a part of the process to actually make a difference, right? And I know I'm talking about advocacy at this moment, but that's a way for us to really address some of the issues that we know is going to come down the pipeline and be able to advocate for people. And then also, like, with Roe v. Wade being reversed, I think Tennessee is a trigger law state, where whatever happens federally, it's instant. So for him to say, I'm gonna leave it to the state.
He knows.
He knows exactly what that's doing.
Right. Old girl was taking pictures with him talking about golden age. It's the golden age again. I saw it on Twitter. I said, Lord,
I was like, what golden age? You mean
Twitter.
Right.
I'm just thinking about Jasmine Crockett and what she said. Bad butch,
Bad
blonde,
bitch, butch, bad butch, body.
That's the golden age, right?
Yeah.
That's the golden age that we're talking about. It's not necessarily like we're actually doing well for the people. And I think that's the challenge, right? Where people who are having medical emergencies and need to have access to reproductive care.
Yes.
The fact that you can't even find reproductive care information on the CDC website, that's an issue in itself too.
Absolutely.
And that information is power, right? At the end of the day, we as people have to make the medical decision, an informed decision, right? At that, to decide, yes, I'm going to take this. No, I'm not going to do this, right? But we don't even get the opportunity to learn.
No.
And
stripping us of that.
And stripping us of that, and then also the physicians, putting so much pressure on physicians and medical staff to be able to provide care, but they can't say certain things.
Right.
Because what? Guess what? They're held by health insurance companies, right?
When it should be the other way around.
Right. Right. You know, there was a case that someone needed this surgery, and it was an infant that was just born and needed this surgery, and because the insurance needed to approve it, the person was waiting for 9 hours in the emergency room with a brand new baby.
Yeah.
And it's like, that's the implications that we're seeing, right? Those are the conversations we haven't been able to talk about, because at the top, it's about what Trump is trying to say and trying to dictate about this Affordable Care Act.
To me, it kind of goes back to like a lack of empathy. And I know, so we become less empathetic about other people's problems because we're so worried about how people at the top are going to look at it, or how it's going to affect you long term. They're not even thinking about the next person. It's just really individual self. Lots of greed, lots of personal anger, hatred. It's a lot of different things.
Right.
And that's not how a system works, especially a system where you're dealing with health. You have to have a level of empathy for people. You can't be in that space. And I think that's where a lot of these policies miss out on, because they're looking at it from a policy standard instead of looking at it from a personal standard, you know, so it doesn't mix.
Right, and we're not even allowed to be empathetic.
No, yeah,
right?
you know.
Because we're so stressed.
Yeah.
If you think about it, chaos causes stress.
Yeah.
When you're stressed, the amygdala is fired, your prefrontal cortex, your decision-making function of your brain shuts off.
We're all working in survival mode.
So we're surviving to make sure that we're protecting ourselves.
And that's what somebody definitely mentioned. Like, they're putting out all this hysteria to keep us in a state of panic, a state of shock, a state of stress, to where we can't function. We can't focus on what the real problem is.
Right, and get to a solution and breathe. Like, what's happening? What are the facts? What can we do? And it's the chaos. That chaos creates that conundrum of like, whoa, what we doing here?
Right.
Yeah.
For sure. So, with that being said, recently, Robert F. Kennedy Jr., the new U.S. Secretary of Health and Human Services, he said some... I love how everybody...
Just JFK is rolling in his grave.
Listen!
He said, what you doing?
What are you doing?
With your bad time. Sorry.
What's your bad?
It's a couple things. Going on.
But he has done many problematic and inflammatory things, just say it outright, crazy things, mostly concerning this vaccine schedule is what we're going to focus on with this one. So he said, the main thing he said that was, colored people, black people should not have the same vaccine schedule as white people, because our bodies, fight off diseases and things differently, and we aren't as affected. Immediately, my mind went to two things. We went to Henrietta Lacks. You're trying to say that we're so different that you have to inhumanely study us.
Mm-hmm. Yes.
And with that, I also, what was that?
Eugenics?
Sarah Bartman.
Okay.
We learned about this when I was at Spelman. She was like, this anomaly of a woman because of how she was shaped, and they took that on as like, oh, she's so different than what we're used to. This is so different than the base level of what white people are used to. So we have to take this piece of them and study it. Mm-hmm. And that's what I feel like this is going back to. It's like, oh, okay, well, they're so different that we have to do this, or they're so different that we have to do that. And it's like, where are we going with this? Because, like I said, my mind immediately went to Henrietta Lacks, especially since that's recently been something in the news about how her family is just now getting things, but
they're getting some reparations from the
I wouldn't even call it reparations. It's like the talks of it, like the talks of it.
It's the start, the very, very start.
Mm-hmm.
Okay.
So definitely wanted to know what you thought about this dangerous way of thinking.
Mm-hmm. I do want to clarify this for those who think that we genetically, black folks, Latino, white folks, we have different genetics. That's not true. Race is a social construct. It is not a biological one. It all stems from the pseudoscience of eugenics. Mm-hmm. That's how they're able to still justify benefiting from black people. Mm-hmm. Like Henrietta Lacks. Her still exist. Vaccines that are done that have been created were because of herself, right? There are so many patents around her cells.
Hello.
Right? Because of this idea that we can study people, and especially people who are people of color.
People of color.
And so for him to say that people of color need to have a different vaccine schedule is a resurgence of this idea of this notion of eugenics, right? That this idea of race-based genomics, when it doesn't exist. Mm-hmm. That's why we see a lot of issues today with certain tests, medical tests. Like, for example, the EGFR, which tests your kidney function. There's a specific race marker to it. but it's actually has caused people to get over-medicated, under-medicated. And guess what happens when you do that happens, right? Kidney function lowers. And then you have dialysis. And then you have more dialysis clinics around black neighborhoods. So I'm kind of pulling away from this conversation just to see the issue of what's happening here with RFK, right?
RFK J.
Yeah.
Junior.
Anyway.
That man.
That man. Because we're starting to see people already have reservations about vaccines. That's a fact. We saw that in COVID. And at the same time, vaccines are important to actually keep certain diseases to the low. And while I do believe that you have to make an informed decision to take a vaccine or not, having someone who's the head of Health and Human Services say, y'all can take you don't have to take this vaccine.
And removing stuff from the website.
Yeah.
And the thing is, Black, Latino, Asian, Native American, Indigenous, we are already socially vulnerable to diseases. We saw that with COVID. While it was something that anybody was getting it, but it was impacting most Black and brown communities. Because of the comorbidities, because of the social vulnerability that exists when you're in a disease state. And also, let's just talk about the continuum of care. When you think about that, there's already racial bias, medical bias in the way that we receive care. Add a vaccine schedule on top of that.
Right. As if people have constant access to care.
Right, exactly. And so those who are already immunocompromised, those already who have invisible disabilities, they're going to be even more vulnerable to something like this.
And vaccine misinformation is literally what made me start this podcast. I actually had a Facebook memory to pop up from like years ago where somebody, and this was literally the determining factor, like, I'm so tired of people just saying crazy stuff. Like, somebody needs to be out here to set the record straight. So the memory was, somebody was like, what happened to chicken pox? They must took chicken pox out of rotation because our kids aren't catching chicken pox anymore. I was like, there's a vaccine for that. Your kids get a vaccine for that. They didn't take it out of rotation. There's a vaccine for that. But a lot of people truly did not know that their child was vaccinated for that. And it was just like, you just go and take your child to get whatever without getting that information. Not to say that you're not supposed to get those vaccines and everything, because schools require them as well. But know what's happening. Know so that you don't expect your child to get chicken pox and they have a vaccine for that. So that's another thing where it's just really like the whole knowledge and fear around vaccines is insane, because people feel like, oh, measles, mumps, rubella is coming back. But I mean, hey, my grandma said it wasn't that bad when, measles was taking over. I'm like, what are you doing?
Why would you outbreak in 2015 in Memphis?
So why would you want that? That's what I'm saying. Like,
people are so okay with measles and polio being back in the population.
And they don't remember, like, the thing is, like, they have this amnesia of what happens when people have measles, what happens to people when they have polio. And so I think one of the challenges that we see here is people not understanding public health terms, and I think that's one of my frustrations with public health. That it's very, like, professional focused. Terms like herd immunity is something that is so foreign to people, or they don't fully understand it. There are people that are not going to get vaccinated and they're going to get the disease, and that's going to expose people. There's people that are going to get the vaccine and that's going to protect them from those who are already exposed. But with having more vaccine, we have this herd immunity that we can reduce the amount of people who have chickenpox or measles or polio. So, and I'm first generation Dominican. And there are a lot of more health issues in developing countries that vaccines help reduce those issues, right? So, yeah, it's a challenge.
Yeah. It's going to be, like we've already been saying, it's going to be interesting 4 years, especially with somebody like him over that section of everything. Because he also has his thoughts about autism and vaccines and a lot of different things. But it's just like, I feel like if you're gonna have that role, you got to also be informed. And I think that's the difference between people that work in public health or work in health. We kind of are informed about it, but it's also making sure that we're able to reach people that aren't as able to relate or understand what is being said. So making sure that they're able to understand those terms, making sure that they're able to receive access to the opportunity to get vaccines, or like to understand why the vaccine is important, or why maybe this is a good option for your child, or why it might not be a good option. I think a lot of times, like we were talking about with the media, they hear one thing, they take that one thing in, and then it's boom. That's what they're. Yeah. So it's like one of those things where it's not really a conversation or them necessarily getting the best information. It's what they hear first.
Right.
And they're gonna go with whoever is at the top. So if we have somebody at the top who says, "Oh, that doesn't work," that might be the only message they get.
Right. Some people, there's like a poll that shared out, and that where people get their most information, their health information from, and it's from their family.
No, it's their Facebook and family.
Facebook and family. What happens when you're sick, Ma?
Yeah.
What do I do? Like, she knows, right?
Yeah.
But she does know, because she's done it so many times to help you, right? So people trust the information, the vessel in which this information is coming from. Now, should we trust Health and Human Services? Should we trust the FDA?
And that's where.
And that's the challenge.
Yeah.
I'm sorry to cut you off.
That's
the challenge. That is a decision that we have to deal with every day. Like, this is information, but what's under this information?
And who is it benefiting?
Who is it benefiting?
Is it benefiting you, or is it benefiting a larger party that might not look like you, might not think like you, might not even consider you?
Right, exactly.
So, a little segue. We've been talking about it a little bit before, the affirmative actions and some of the things that have been passing. I'm going to read off some of this stuff. When I was going into this episode, I had a really good time looking over this information, because it's just, as somebody that deals with public health, you're just like, man, this is crazy, because this is from the White House. This is what the White House is saying. So
WhiteHouse.gov.
Yeah, this is from the White House. This is what they had to say. So I'm gonna read it off like how they had it put on here, and then I'm gonna get your thought process on it. So it says, Donald Trump wasted no time delivering the promises he made. He signed more executive orders his first day in office than any other president in history. Within the first 100 hours, his second administration, Trump took hundreds of executive order actions. The Department of Homeland Security reinstated official use of the illegal alien instead of using the term undocumented non-citizen. I didn't like that. He also says that he signed a series of executive orders ensuring that the elimination of the DEI practices and ensuring that there was no more merit-based hiring. DEI staff have been placed on leave. At this point, he's actually started to terminate some of those positions. Trump has ended the affirmative action mandate for federal government hiring. Trump signed an executive order telling agencies to stop remote work practices and directing them to return to work. And if you didn't return to work or in the office, then you no longer had a job. He made sure that he declassified some of the files that he felt like American citizens should see. He did the EV mandate. Donald Trump also said he wanted the military border to be more secure, so he has been deploying troops to the border to make sure that there is nothing going on with that. He also changed the name of the Gulf of Mexico to the Gulf of America. And if you get on Google Maps, it definitely says that
Off of America.
Off of America, whatever that. Yeah, he signed that order. I think there's bigger fish to fry, but we're gonna start somewhere. He also did this is what the website said, and I was just like, wow, this is crazy. Trump said he would drill, baby, drill, and he signed an executive order to open up the offshore drilling and allow energy exploration in Alaska. He said that he would end weaponized government, and he signed an executive order to do that. And then he said he would also pardon the J6 hostages, which he did as well. That's just some of the stuff that he did in like the first 100 hours in office.
That's a lot.
Yeah.
And I think, well, he could sign his executive order.
Yeah.
There's also 2 other branches of government that is important for us to know. You would say something?
The only thing I was going to say was, I kind of think the method to his madness was sign so much stuff, get people so frazzled. Yeah, so that way it's harder for us to be able to stop what he's trying.
Decipher.
Yeah.
Because it's hard.
It's a lot.
It's a lot.
All at once.
All at once. You were mentioning affirmative action, right? Mm-hmm. And we already started to see the issue with affirmative action when it was reversed back in 2023 through a Supreme Court ruling. And that's where we start to see now that elimination of race-based programs within universities. People don't understand that affirmative action has really benefited white women.
Yeah.
And let's just keep it a buck.
I saw a tweet mentioning it. It was like, my daughter got fired from her job and she's not even black. They were like, did y'all forget that women are technically a minority in some spaces?
Right. And the same people that helped him get into office, like Venezuelans, like the issue. You saw that, right? Mm-hmm. With he used us. Mm-hmm. Ahora te importa. Like now you care.
Yeah.
And I think that's one of the challenges that we see, that we have, not we, because I'm not included in the we.
Yeah.
People have this fanfare of Trump, this fanatism, that they don't really see the implications of his action.
Because he sent us that STEMI check, remember?
And I was like,
he didn't what people.
He didn't send that to us.
That check, y'all, and he finna send us another check. That's why I'm like, no, he didn't want us to have that check.
If it was Biden, if it was another president, that STEMI check would have still made it.
Yeah, it would have been more, probably.
Right?
Would have been faster.
Yeah. Exactly. And they didn't have to actually file your taxes in order to actually get it. But
right.
I digress. But that money was already going to be there, because once you declare a state of emergency, especially public health emergency, money is released to address the emergency at hand. And so they associate the STEMI check with Trump, but really, that STEMI check was going to come anyway, Trump or not.
Anyway.
Yeah,
right.
And I feel like right now we are still seeing the start. He's not even started. He's not even in the first 35 days.
Right.
Yeah.
Right.
It ain't been a month. It's barely been a month.
It's barely a month.
And
I'm saying 35 days because we know that it's been a month already. But the fact that we are not even halfway point of the first 100 days of true testament of what a president can do, and what is being used as kind of like the measure of a president in their first 100 days of office, or a political figure. We still don't know to the effect of how this affirmative action, or this campaign to remove affirmative action, what is it really going to look like? But the big thing is, though, the reason why they're attacking specifically where there has been protection is because they know the first thing that we could do to control the masses is removing education.
Yep.
Removing health services. Removing your right to vote and be politically engaged in a democracy. He ran on the campaign saying, vote for me once, you'll never have to vote again. Excuse me? What?
That was insane.
That is insane. What do you mean we'll never vote again?
The fact that enticed people was insane to me.
And I think, it's the fear. People say that the majority of people in this country are white.
Yeah.
It's not true. Actually, the majority of this country is brown, and they're afraid, and they know that.
That's why
they said by 2050 there's going to be 2050 is here.
Yeah.
Because I'm only saying this, when you disaggregate the data, a lot of people who are people of color, like Latino or Asian, sometimes just put white. So that skews the numbers. And you can look this up online. I'm not saying this, this is research. When we start disaggregating the data, when you start seeing the number of children being born in this country, it's mostly black and brown. And so this fear of maintaining the status quo of what an American should look like is the implications of what we're seeing now. This attack on affirmative action, this attack on policies, acts that have protected people. The fact that he wanted to reverse the Civil Rights Act, I'm just like, wait, what?
I want to reverse everything.
Everything. Yeah.
So this has been a very informative, enlightening conversation. Thank you so much for coming on. We want you to plug anything that you have going on, anything that you have in the future or in the past. Just let people know where we can find you.
I definitely spoke on my public health side. The side that I haven't had a chance to talk about is the healing side, the communal side, right? We need us. We need us so much right now. And we are all grieving what was, what we know the future will be because of the situation that we're in. So I encourage you all to think about this moment, to really tap into your community, to tap into your own ways of healing. And I say healing both the physical body, but the spiritual body, the mental body. And I talk about grief and composting grief in my TED Talk. I did a few months ago, how we can learn from the stages of grief as a way to reframe our approach to social change. Social change and grief have a lot of similarities, especially in the stages that it evolves. And so while this conversation that we had is infuriating, it is disheartening, it is a way for us to lose hope, I encourage us to kind of recompost all this BS. And what are the new ways in which we can relate to each other? What are ways that we can tap in with each other? I just came from yoga. Do some yoga with your friends. If you don't know how to do yoga, there's a lot of YouTube videos, right? Right? And so, or just tap into the people that are in your community. And yoga is one aspect. There could be other ways in which you could tap into your healing. Get back to our roots, right? So I want to encourage us to think about that. While we can think about policies and systems and the environment, we also have a ways of healing when we're in community with each other.
Love that. I love that. No, it's great having you.
Thank you for coming out. Yes. And that concludes this episode of the Hood Health Report.
Thank you.
So this is a wrap for this episode. I hope y'all enjoyed it. You can follow us on Instagram, which is Hood Health Report, as well as Facebook and Twitter, Hood Health Pod.
We also have a TikTok page now, Hood Health Report. Follow us there.
Yeah.
Don't forget to subscribe to the YouTube channel. All of the links will be in the descriptions and the bios where you can click on.
Tap, like, comment, do it all.
Subscribe, all of the things. Share it with a friend.
Yes.
Share it on your social media.
If you have a TikTok, make a little video, send it.
Let us know you're out there watching, guys.